For many of us accustomed to a regular day-to-day pattern, COVID-19 has tipped this familiar axis and has turned the world upside down in a short span of a few months. How we live and interact with each other, how we work and communicate, how we socialize, and most of all, how we practice good hygiene, all of these things have been drastically affected and will remain that way in the foreseeable future. Every aspect of our lives has been affected by a simple virus. Life as we know it is taking a drastic turn no one expected at the start of the year. Health-wise, this pandemic has affected thousands of people, who are either sick or are being killed due to the spread of this disease, especially those who are immunocompromised. As this event has also exposed the lack of support and funding for our health frontliners as well as how important a solid and supported national health care system really is. COVID-19 has also taken down almost all economic activity on a global scale as the lockdowns affected the sources of supply, which has led to a drastic drop in the global economy due to shipments and deliveries coming to a halt. There are now restrictions of traveling from one country to another country and even localized border-to-border checkpoints to lessen the spread of this disease. From what we currently know, COVID-19 spreads through respiratory droplets, which typically travel about 3 to 6 feet and settle on surfaces, where they can live for a few hours up to several days, according to the World Health Organization. There is a risk of catching the disease by inhaling those particles, but there is a more significant risk of getting it by touching surfaces, such as desks, handrails, or doorknobs, where those droplets may have settled. Another fact to note is that the new coronavirus preys on both young and old. But the more severe cases and the higher rates of death are among the elderly. The reason for this is as yet unknown. Some scientists suspect that this may be related to the weakening of the immune system in the elderly. Indeed, senior citizens are known to be more susceptible to many infectious diseases. It's known that the lung and respiratory tract tissue stiffens with age. This is partly due to the connective tissue cells in these organs, which deposit more protein fibers in the tissue with age. Basic hygiene measures may seem overrated, but in an era of viral infection, these simple steps are critical and important for preservation of life. Washing hands with plain soap and plain water kills viruses, but only if it's done thoroughly and often. Hands should be scrubbed for 20 seconds at least, which is around the time it takes to sing the "Happy Birthday" song twice, to ensure germs won't be transferred to objects or spread from one individual to the other. Hand sanitizers on one hand may be helpful, if they contain at least 60% alcohol, according to the Centers for Disease Control and Prevention. Note however that if your hands are already dirty or greasy, then such sanitizer won't effectively work, which is why the agency favors hand washing. A 2006 study found that hand washing can cut the risk of respiratory infection by 16%, and a 2008 study showed a 21% reduction. Washing hands has been clearly proved to decrease disease transmission and lower your chance of getting infected. Wearing a face mask and face shield wherever you go out of your house is now considered a sign of respect, as wearing a medical mask is one of the prevention measures to limit spread of certain respiratory diseases, including 2019 nCoV, in affected areas. Masks help stop the transfer of germs from one individual to the other. A common practice we all do that is a big no-no at this time is the touching of one's face. It's also important to avoid face touching because germs can get into the body through the eyes, nose, and mouth. Contaminated hands can transfer the virus when people rub their eyes, scratch their noses, or touch their mouths. Trying to be more mindful of touching our face decreases our chance of infection. Our daily lives took a whole 180 degrees turn when COVID-19 entered the scene. Before, going out used to be as easy as 1, 2, and 3, but now, we all have to use quarantine passes, and some regions even limit the days as to when citizens can come out to buy necessities. Children would wake up early and hastily prepare for the school bus to take them to school, but now with the lockdown, online classes have been implemented to cope up for the educational needs of the kids. Same goes for the adults who are now working from their respective homes. Social gatherings like weddings, birthday celebrations and regular parties are now temporarily on hold. Even wakes for burials are hastened. Public transportation now has barriers in between to ensure social distancing measures are followed. Outside accessibility is now very much limited, causing economic halt as establishments temporarily close. Despite the lockdown limiting our capabilities to roam outside and enjoy life as we used to enjoy, it has made us appreciate being at home and staying inside with our family and pets, to relax and take a break from the busy ins and outs of our pre-COVID life. To cope up with the restrictions of going in and out and the obvious financial change we are facing with a lot of businesses closing and the economy drastically falling, a lot of individuals started growing their own crops at home. In fact, people are flexing their homegrown crop harvest like tomatoes, eggplants, etc. on their social media accounts, to serve as encouragement for other households to start doing so. No one is prepared for such drastic changes in our lives, but resiliency will be our best weapon. It won't be long until we have this figured out if we abide by safety protocols and health mandates set by our officials, and of course to stay at home. Wash your hands and don't forget to always be positive, attitude-wise. How has the COVID-19 pandemic affected your life? Share your experiences with us in the comments section. Keep safe, everyone.